Deuk, and it is January 13, 2021. I'm here with one of my lovely patients that had back pain for many years. Her spine was twisting. She's an instructor for yoga, and she was noticing her back was sticking out on one side more than the other. Of course, there was a lot of pain in the back, and it was going down her right leg. So she was losing the strength in her right leg. She had sciatica, and she came to us, and we actually fixed her entire spine with outpatient surgery. It was an outpatient procedure. She went home 2 hours after the surgery. She's here now to get her staples out and to get a checkup. How are you feeling today?
Great, very good. Really good.
All right.
Confident.
The pain you had before surgery, do you still have that pain?
No.
It's gone.
It's gone. It's just, it's not at all like it was. Life is totally different.
How long did you have back pain for?
6 years.
So she had back pain for 6 years.
Mm-hmm.
Did it affect your life?
Mm-hmm. Oh yeah.
How?
I had to sit down after work. I had to rest my body after work. I couldn't go outside and work in the yard. So now I'll be able to anytime. Mm-hmm.
And she needs to see my lips because it makes it easier for her to understand me.
Mm-hmm.
Did the back pain or leg pain affect your work at all?
Oh yes.
How?
My postures, in my yoga postures, I had to scale back on my postures and not make it as hard.
Okay.
So now we're flowing through. We're going to flow much easier.
Good.
Mm-hmm.
Yoga is one of those types of therapies that we recommend because it's been proven to help with back pain. But the kind of back pain she had from her spine twisting and slipping, it could never get better with yoga, unfortunately. She maxed out the yoga. You can see she's quite fit. So she's doing well. And anything you want to say to the audience?
No, I recommend him highly. He's a very good doctor. A very good doctor. Thank you.
Thank you. Thank you. I would just say that the surgery that we did for this young lady included putting screws and rods from L2 all the way down to the sacrum. It was major surgery. Deuk Spine Institute is the only place in the world that patients can go to have multi-level surgery to fix their problems at multiple discs, whether they're herniations or spinal stenosis or scoliosis, whatever the problem is. We're able to do that multi-level surgeries and have patients go home the same day. Her surgery took 4 hours to do, maybe 4.5. That surgery would have taken pretty much the average spine surgeon about 18 to 20 hours to do. We did it in 4 hours. The patient went home safely right after surgery, and here she is a week later, and this is a typical success story at Deuk Spine Institute. The only place in the world to get outpatient, multi-level cervical or lumbar fusion surgeries. Okay? That's it. Enjoy yourself. Have a nice day.
Thank you so
Come
much.
back and see me in 5 weeks, okay?
All right.